The shared medical record? Well, it's rather like the story of a ship that has just been sailing round and round in the Atlantic for the past 10 years without any particular destination in mind. The project all started off by making a lot of noise in 2004 when the Minister of Health at the time, Philippe Douste-Blazy, launched the idea of a single record that would enable all the players in the health sector to know what treatments the patient had been given in the past. The idea was relevant. It looked like an effective way of improving patient management and coordination between the health professionals, avoiding, for example, superfluous examinations or dangerous drug interactions, thereby saving costly hospital care. The project seemed realistic. Hadn't Denmark launched a similar record in 1994, now used by 60% of the Danes? Thus, haloed by the shining light of all these promises, the SMR was officially launched by the law of the 13th of August 2004. It was ambitious, too ambitious perhaps. Create a record mentioning the patient's name and treatments, far too simple. The content of the SMR was to be detailed, containing the history of the patient's consultations, test results, personal risk factors, medical imaging, and even some space for the holder to make comments. Everything was there. Once tested in everyday practice with doctors who don't have time to spend hours killing information into their computers, the record began to go stale. And the SMR got a nickname, the record that never got off the ground. The ministers came and went, Xavier Bertrand, Roselyne Bachelot, Marisol Touraine. The stops and starts continued. At the end of the day, the project cost 500 million euros for 500,000 records opens, with only 10% of the information initially planned filled in. As a cruel comparison, 3 years after the SMR, the pharmaceutical record already exceeded 36 million records opened and only added up to a mere 5 million euros funded by the pharmacists themselves. The lesson to be drawn from all this: good tools are of no avail without coordination, steering, and political willpower.